Member for Fyzabad.
Thank you. Thank you very much.
Doctor.
Thank you very much, Madam Speaker, for the opportunity to contribute to this 2025 financial year budget debate. Madam Speaker, I will not say too much on the contribution of my good friend, the Minister of Agriculture, except to invite him to visit the Otahiti fishing facility at his convenience to address some of the pressing issues of the fishermen in that area.
You have a potential PNM candidate, he might bring himself down.
The other issues that were raised by the Honourable Minister will be addressed by my colleague, the Member of Parliament for Couva North. Madam Speaker, before I continue, I just want to reflect on and commend the response of the Leader of the Opposition last Friday to this budget debate. The Member for Siparia's contribution was a clinical dissection of the budget presentation. It's poetic. And of course, the policies that she proposed represent very well the solutions that are required to take our country forward. Madam Speaker, I also want to, and of course it shows that the Leader of the Opposition, the Member for Siparia, is well prepared, willing and able, I must say, to take over the reins of government as soon as that opportunity arises, Madam Speaker. Allow me also, Madam Speaker, to commend my colleagues on the side who have spoken and have made some very able contributions, Madam Speaker. Madam Speaker, I also want to take the opportunity to thank the great constituents of Fyzabad. Constituents have been very patient over the last 9 years, Madam Speaker. They've extolled our national virtues in terms of patience and tolerance, in terms of what they've had to endure under this government, Madam Speaker. But I want to give them the assurance that as soon as the government changes under UNC government, that all of the issues will be fixed, Madam Speaker. So I want to thank them. I want to thank them for that and for giving me the opportunity to have served them and represent them for the last 9 years. Madam Speaker, I also want to take this opportunity before I go into the meat of my contribution to thank the staff at my constituency office, led by my very capable and able Office Manager, Mr. Dale Kewal, and the rest of the staff, Madam Speaker, and all of those who have supported me during the last 9 years in Fyzabad, Madam Speaker. So, Madam Speaker, my plan in this time is just to respond to a few of the issues that the Minister of Health raised, to raise a few other issues in the health sector, and also to speak on some constituency matters, Madam Speaker. Madam Speaker, the member for St. Joseph opened with an acronym used by my colleague for Approach West, and he attempted to account for the expenditure under the health sector. Madam Speaker, I will use a different acronym as my team today, and my acronym will be VFM, Value for Money. Madam Speaker, during the Minister's contribution, trying to account for some $7.5 billion allocated this year, and also trying to account for the sum of $56.89 billion spent under his ministry in the last 9 years, did not use the term value for money even once in his contribution, Madam Speaker. Madam Speaker, ministers of finance, not only in Trinidad and Tobago, but throughout the world, are always in a dilemma when it comes to expenditure in the health sector. Returns on investment in healthcare are sometimes difficult to calculate in monetary terms, Madam Speaker. But I assure you, Madam Speaker, that the benefits are measurable if you set targets and if you put in place certain performance indicators. And I dare say, Madam Speaker, this is what has been missing under the performance of this government in the health sector. Now, the Minister of Health spoke about people, process, and product. I like that term. I like those terms, Madam Speaker. And I will hinge on those terms with regards to my presentation as I go forward. I agree with this model, and I will elaborate on some of these. I also want to add 2 more Ps to the discussion, which will help to complete the picture, and those Ps are policy and plant. Madam Speaker, despite the tremendous expenditure in relation to the overall budget allocation under this government, there seems to be a disconnect between the vast sums of money spent annually and the quality and quantity of healthcare services delivered to citizens, Madam Speaker. And this is the product, I believe, that the Honourable Minister was speaking about when he used the term product. And we'll talk more about the product as I go forward. Madam Speaker, there are still many complaints from patients trying to access healthcare services. I will not burden the House with the sources of these, but on a daily basis, there's still complaints of long waiting times in the accident and emergency, long waiting for beds, long waiting times for clinic appointments, for elective surgeries, for investigations, x-rays, MRIs, CT scans, and so on, blood tests, and so on, Madam Speaker. And there's still complaints about drug shortages. And of course, there are issues and complaints about the care of babies and their mothers in our NICU and maternity units, a matter I'll come to later on in my contribution, Madam Speaker. So, Madam Speaker, the big question is, are citizens getting value for money? Madam Speaker, the Minister of Finance himself, in this House, in the mid-year budget review on the 6th of June, when faced with a request by the Minister of Health for an allocation of an additional sum of $495,286,000 during the Standing Finance Committee stage. And I quote the words of the Minister of Finance here, Madam Speaker. And these are the Minister's words from the Hansard. Another $5 billion or so, it is proving quite difficult to finance the purchases of free pharmaceuticals, and to find that $500 million is going to prove to be difficult. So understand, I still quote, Madam Speaker, understand that we as a country spend huge amounts on healthcare. I agree, my words, and I continue with the Minister's words. And it's something we need to look at to make sure what we are getting, value for money, and so on. So, Madam Speaker, the Minister of Finance himself perhaps is sending a message to his colleague in the Ministry of Health. Hey, listen, are we getting value for money for this vast sum of expenditure in the health sector, Madam Speaker? Madam Speaker, in relation to the financing of pharmaceuticals, before I leave that topic here, based on the figures provided to us, we see that the bill for pharmaceuticals and non-pharmaceuticals, including CDAP, is close to some $700 million annually, according to the Ministry of Health figures. Madam Speaker, at the Public Accounts Administration Committee meeting on the 15th of May this year in this very House, when NIPDEC and officials of the Ministry of Health participated in that inquiry, we learned that financing has been used to raise some of this $700 million during the past few years, Madam Speaker. And I make this point simply to state that when you look at the cost of financing, I'll just give an example for 3 loans, Madam Speaker. And these 3 loans amounted to $823,912,888. The interest on these loans, Madam Speaker, is amounting and will cost taxpayers another $130,362,545. I know borrowing is sometimes important, Madam Speaker, but I make the point just to say that it means that when the government borrows to fund this key item, it means that the actual cost of drugs and supplies to the taxpayer is higher. And therefore, it is more reason to ensure value for money and accountability, Madam Speaker. So I ask, Madam Speaker, what is the issue? Is it a process issue? Is it an issue of process in the terms of the running of the health sector? Is it an issue with what we call the supply chain disconnect? Madam Speaker, and I want to give the assurance to the population that, under a UNC government, we will fix these issues, Madam Speaker. There will be, Madam Speaker, there will be no more issues of stock out when you get a prescription. There will be no more surgeries being postponed because hospitals and doctors do not have this and they do not have that, Madam Speaker. So, Madam Speaker, I just want to move on in terms of the people. So we spoke a bit about the process, and I'll come back to other issues with process. Well, let's go to the people. The other factor that is important in the equation, and this equation of the delivery of healthcare. So, according to the Honourable Minister, the Ministry of Health, 67.1% of the annual budget allocation in health goes to the 4 regional health authorities in Trinidad. This amounts to some $4.2 billion, and of this amount, $3.7 billion is spent on salaries and wages. So it's spent on people, Madam Speaker, and we are grateful for that. We have some 21,000 workers in the healthcare sector amongst the RHAs, and they need to be well compensated. It is a fact that people are the backbone of healthcare delivery and so on. So I will come back and deal with some of the people issues in the health sector. But before I speak about that, Madam Speaker, allow me to just go back to the plant issues, because I think it's important to put in perspective that as far as the plant, and when I say plant, I mean plant and infrastructure, it means hospitals and health centers. A very good platform was laid by the UNC, the People's Partnership Government, in 2010 to 2015, Madam Speaker. It will be remiss of me not to mention the completion of the Scarborough Hospital, the San Fernando Teaching Hospital in 2014, adding an additional 230 beds to the healthcare sector, the Couva Children's Hospital, another 230 beds, and of course we are well aware that the sub-turning for the Point Fortin and Arima hospitals were done under the partnership. And the member for Point Fortin will be very aware that there was a completely refurbished health center in Point Fortin, and the member for La Brea would be very familiar with the new health center in Palo Seco. In addition, of course, Madam Speaker, we refurbished and repaired over some 40 health centers. So there is enough plant and infrastructure in the health sector, Madam. There's no shortage of that. There are more structures coming on board and so on. But the issue now would be to provide people to run these plants and provide health care. And more than people, Madam Speaker, the issue would be to look at the processes of how we deliver health care and how that can be changed. So who are the people in the health sector, Madam Speaker? So at the RHA level, we speak to the boards and the senior management. Those are very important people, Madam Speaker, very, very important. These are the people who are responsible for delivering the healthcare product according to the policy which is formulated by the Ministry of Health and the Ministry of Health and the government. This requires responsible, competent, and innovative people, Madam Speaker. You need to have people in those positions, who can be innovative, who can, think outside the box and find solutions, because healthcare, sometimes situations can arise where there's no learning, there's no precedent. It requires people with a patient agenda, Madam Speaker, not a political agenda. Madam Speaker, it requires people who will put patients first, Madam Speaker. And Madam Speaker, it requires people who will put back the care in health care, Madam Speaker. And this is what this country is lacking, Madam Speaker. Madam Speaker, I dare say that this minister continues to put square pegs in round holes at the board level. And as a result, several CEOs and certain managers do what they want, Madam Speaker. There's a lack of accountability in the running of some of these RHAs. So, Madam Speaker, I just want to give an example. Let's look, for example, at how staff is recruited at the SWRHA, Madam Speaker. Earlier this week, in one of the newspapers, there are two ads. Both are ads for vacancies in the Southwest Regional Health Authority. And there are two sets of vacancies. So one speaks to photographer, communication assistant, nutrition and dietetic attendant. But the point I'm making here, Madam Speaker, is that the applications for these ads have to be sent to the Human Resources Department, Southwest Regional Health Authority, Level 2. I'm very familiar with that. I was the chairman there, and this is the correct procedure, Madam Speaker. There's nothing wrong with that. That is where applications for employment are supposed to go. But, Madam Speaker, an ad on the other page of this newspaper on the same day that is trying to recruit a manager in corporate communications, a nurse manager in secondary services, security services manager. And the applications, you are invited to send your application to the office of the chairman of the Human Resources Committee at the Southwest Regional Health Authority. Now, Madam Speaker, the Human Resources Committee, the Human Resources Committee is a board committee, Madam Speaker. The chairman of that committee, if I am not mistaken, unless things have changed, is a board member. So I'm just wondering, Madam Speaker, why it is that these applications have to go to that particular office first. isn't it correct and the appropriate thing that the application should be processed, at the level of the Human Resource Department? But I leave that there, Madam Speaker, and I moved on. So, Madam Speaker, what is happening, at the SWRH? What is happening with the process? How is it working? Madam Speaker, I am told that there was a power outage in the laboratory at the San Fernando General Hospital last night, Madam Speaker. And the auxiliary generator did not activate.
What?
Do you know what happened, Madam Speaker? As a result, blood products have been compromised, and no blood products can be provided for elective cases at this time. Madam Speaker, blood is currently being sourced nationally for emergencies only, Madam Speaker. And I raise this because the issue of generators at the San Fernando Hospital has been raised before.
And Mount Hope.
In Mount Hope. But before I go there, Madam Speaker, when this happens, it means when you prepare yourself and you take the time off and you go to the hospital, for an elective procedure, there's a lot. You've waited already. You've made the sacrifice and so on, only to be told that your surgery was postponed, Madam Speaker. It's heartbreaking. I have one constituent, Madam Speaker, who visits my office every day I'm in office, Madam Speaker. And the problem is that she's been trying to get a cataract surgery done for the last 3 years, Madam Speaker. And Madam Speaker, she gets this excuse and that excuse, Madam Speaker. There's something wrong with the process, Madam Speaker. There's something wrong with the process. So, Madam Speaker, this is just one of the issues. There are other issues, of course, at the SWRHA. We have the lack of ambulances. You have a lot of them being non-functional because of the breakdown and so on. And this is an issue when you have to transfer critically ill patients from the Sipare District Health Facility and indeed from the Point Fortin Hospital to the San Fernando General Hospital, Madam Speaker. So, Madam Speaker, I will leave that matter there and move on, Madam Speaker. And, it's no better at the other RHAs, Madam Speaker. So, for example, let's just look at what is happening at the NCRHA with regards to process. Madam Speaker, quite often on a regular basis, we see full-page ads being taken out in the newspapers, telling about the work of the NCRHA, work that is part of their remit, Madam Speaker, work that doesn't need to be advertised. This is what they're receiving the allocations for. So we see full-page ads, but these full-page ads are taking precedence over repairing the leaking ceiling of the dining room at the Mount Hope Women's Hospital, Madam Speaker. It is taking precedence over the fixing of the electrical system at the Eric Williams Medical Sciences Complex, Madam Speaker. And also, the expenditure there could have been put to better use in terms of providing full operating lists for the surgeons at the Eric Williams Medical Sciences Complex. Madam Speaker, I want to invite the Minister of Health, to check with the general surgical listing at the Eric Williams Medical Sciences Complex and find out if it is true that general surgeons are allowed to operate only once per month, Madam Speaker. That is perhaps the reason why the waiting list for surgeries are so long, Madam Speaker. Madam Speaker, there's a patient who has to have something called a reversal of a colostomy. A colostomy, Madam Speaker, is when you have a surgery, and at that time, the surgeons cannot connect back your bowel. They take out a piece of your bowel. You're left with a bag. It's called a stoma. So you walk around with this bag, Madam Speaker, and you become very anxious. It creates a lot of psychological issues because you're walking with a bag that is draining, feces, and you have to be very cautious. Your whole life is limited. And therefore, Madam Speaker, when the time comes to reverse that colostomy, that's the name of the procedure. When that time comes, you await very anxiously, Madam Speaker, the date for that surgery. And if it is that you're told that it's going to take, 2 years or 3 years, when that should be done in 6 months, then, Madam Speaker, it creates a lot of distress for patients. And this is the point I'm making, Madam Speaker. So, Madam Speaker, I move on there. We spoke about the people. We spoke about the people who are the helm, the managers and the board members and so on. But there's also the issue with the doctors, Madam Speaker. There are also people within the health sector that we talk about. And I have to go back to this, Madam Speaker. I have to ask how many of these young doctors are waiting on their house officer positions. Just a few weeks ago, we would have had so many new interns graduate, Madam Speaker, and they joined the line now. But more than that, Madam Speaker, what is the process for appointing house officers? I am told that it is being done in a way that if you know someone there, you get house officer position. I invite the Minister of Health to look into this, Madam Speaker. It seems to be happening at some of the RHAs. People are jumping the queues and so on. Is there a process? I invite the Minister to state whether there's a process for doing this thing in a fair and transparent manner, Madam Speaker.
There's
And I
integrity
also,
in the process.
yes, of course, and Madam Speaker, I also invite the government, so many unemployed doctors, young doctors, have any opportunities been explored, within CARICOM, Madam Speaker, to find work for these doctors? Is that something that has been explored? Madam Speaker, have any opportunities been explored in nearby Guyana? I had the privilege to visit Guyana just a few months ago, and wearing the other hat I wear as a medical practitioner to attend a conference. And there are 9 new hospitals being built in Guyana, Madam Speaker, and they will require a lot of doctors, Madam Speaker. So I am sure that the government is aware of that, and I'm just asking whether any attempt is being made to explore those opportunities, Madam Speaker. Madam Speaker, there is another issue with regards to doctors who work at the regional health authorities. And this is the issue of appointing consultants or specialist medical officers. And I am told, Madam Speaker, that the criteria for appointing these senior doctors, because the buck stops with these doctors, Madam Speaker. They are the ones who have the highest level of knowledge and skills and so on. At the end of the day, they're responsible for you, for your life, literally speaking, Madam Speaker, when you go there as a patient. And I'm told that the criteria may be different among some of the different RHAs. Again, I want to invite the Minister of Health to look at this and see whether it's a matter of expediency or for other reasons. I don't want to go into that, Madam Speaker, for other reasons that you have appointments taking place where you may not have the same quality in terms of the specialists at the different RHAs, Madam Speaker. But Madam Speaker, we will fix that. We'll fix that. I think it's important, the time has reached, Madam Speaker, in terms of all of this healthcare expenditure, to have something called a central recruitment agency. When I worked in the UK, Madam Speaker, all doctors at a certain level were recruited at a central agency in a fair, transparent manner and so on. And then the state, in this case the government, would use the list to allocate doctors amongst the different RHAs according to the needs, Madam Speaker. So you don't end up with a situation where you have, a large number of doctors at one institution where less work has been done. So there is a mismatch. In other words, you have a longer waiting time in one RHA as opposed to the other. That needs to be fixed, Madam Speaker. Madam Speaker, I'll move on quickly to the issue of nurses. Again, the nurses seem to be receiving a raw deal under this government, Madam Speaker. Last year, if I may refer to an article here, on the 5th of August, with a call for increased patient-to-staff ratio, salary increases, and so on. 1 year after, Madam Speaker, I doubt that anything has improved in terms of the working conditions for nurses, Madam Speaker. Again, we talk about the people, we talk about people in the health sector, but do we really, are we really treating, is this government really treating, with these issues? And I'll just raise one issue that the head of the Trinidad and Tobago Nurses Association raised, and he said that part of the shortage of nurses was that the RHAs would take them off the ward to staff the authorities' ambulances. This is a fall along in the process, Madam Speaker. You can't take highly trained individuals, nurses with qualifications and skill, and put them, and put them in ambulances and so on, because you perhaps don't have enough emergency medical personnel. This is the president of the TTNA is saying this, Madam Speaker. So, and of course, when they leave the ward, you have understaffing on the ward, and then you wonder why things happen on the ward, Madam Speaker. So, Madam Speaker, Madam Speaker, there seems to be a lack of vision, a lack of leadership at the highest level of the Ministry of Health and perhaps this government. And, citizens are not getting value for money, Madam Speaker. If I am to answer the question that I asked myself at the beginning of this contribution. So, Madam Speaker, the RHA Act is now some 30 years old and remains a good model, Madam Speaker. But perhaps the time has come to review and tweak how the RHAs are run. And, Madam Speaker, I dare say that the UNC government will undertake such a review to ensure, without the loss of any jobs, Madam Speaker, because people will jump up and say you're going to fire people. That's not the idea. The idea is to review to ensure that citizens once again receive value for money from the RHAs. There needs to be some sort of tweaking in terms of how the models are run, Madam Speaker. But before I leave the issue of people, Madam Speaker, allow me to thank all the healthcare workers in this country who go beyond the call of duty in the most difficult circumstances under this government to deliver healthcare on a daily basis to suffering citizens. We ask them to remain strong, Madam Speaker. Their own suffering will come to an end when those opposite exit the corridors of power and return to where they belong on this side, Madam Speaker. Moving on, Madam Speaker, I want to turn to some other matters that the Minister raised in his contribution, and that is to speak briefly on the issue of CDAP. At a recent PAC meeting that I alluded to earlier in my contribution, Madam Speaker, the NIPDEC officials indicated that some 186,000 patients are registered for CDAP, with some 49 drugs in the formulary. The Minister indicated that we had something against CDAP. Madam Speaker, I want to give the population the assurance that we on this side have absolutely nothing against the CDAP program, Madam Speaker. In fact, we believe, I want to make it clear, we believe that it is an important mechanism in the fight against our biggest enemy in this country, after the crime that is, Madam Speaker, and that is our NCD burden. We believe that, and we agree with that. All we want to do, Madam Speaker, with regards to CDAP is we want to ensure that the most efficacious drugs are available to patients as determined by the medical experts, Madam Speaker, and not the politicians. So, Madam Speaker, we will ensure that CDAP remains available to those citizens who need it and with their most appropriate drugs for their conditions, Madam Speaker. Madam Speaker, I move on quickly now to some other matters in the health sector, some of which come directly under the purview of the Ministry of Health, Madam Speaker. So there's something called the vertical services, which come directly under the purview of the Ministry of Health and the Minister of Health. These are services that are provided aside and apart from those provided by the RHA. And Madam Speaker, one of these services, vertical services, has to do with insect vector control, Madam Speaker. Minister of Health in his entire contribution managed to avoid any reference to dengue cases, Madam Speaker, or the insect vector control division, Madam Speaker. So, Madam Speaker, I want to ask, whether the insect vector control division is the abandoned child of the Ministry of Health, Madam Speaker. There have been many shortcomings of this department which have been highlighted in light of the current dengue outbreak. And at one point, of course, we had the usual blame game, which was being played as to who was responsible for what, Madam Speaker, who had to spray this, spray that, spray the other. And of course, I want to take the opportunity to congratulate the Siparia Borough Corporation, the Penal Labour Borough Corporation, and all the other UNC-led corporations for their leadership in taking the initiative in this fight against dengue, Madam Speaker. There are currently still many problems, I'm informed, with regards to the shortage of chemicals and the shortage of safety gear for workers and so on. But, Madam Speaker, before I leave the issue, the insect vector control division, Madam Speaker, I'm informed, and I hope I'm really wrong on this, that if you're looking for a good second-hand vehicle, Madam Speaker, in good condition for a good price, the place to go is the insect vector control division, Madam Speaker. Madam, I am told that you can get a good vehicle for $2,000. It just requires a small, a little change of part here and there, Madam Speaker. How can you acquire it, Madam Speaker? Minister of Finance, how can you acquire it? You can acquire it because apparently these vehicles are auctioned, and friends and financiers and those in the know are invited to bid for these vehicles, Madam Speaker. I leave that there, Madam Speaker. And of course, Madam Speaker, with the allocation, the budget allocation for the insect vector control division, I want to ask the Minister of Health whether the Gillingham Junction office, which is the main office of the insect vector control division, which currently has no air condition, and therefore the staff report there at 8 o'clock and they leave at 8:15, Madam Speaker, because they cannot work, whether the $2 million allocation to the insect vector control division will fix that problem, Madam Speaker, and I leave that right there, Madam Speaker. Madam Speaker, I want to move on to something that is very dear to me, not only as a member of Parliament, but also as a medical practitioner of some 40 years in obstetrician gynecologist. And I want to speak briefly, Madam Speaker, with regards to the disaster that occurred at the neonatal intensive care unit of the Port of Spain Hospital in April. This week made 6 months, Madam Speaker, since that tragedy occurred, of 9 babies being lost in a matter of 4 days, Madam Speaker. And there was a reflection in the newspaper, Madam Speaker, where one of the mothers was wondering aloud whether and the headline is whether we have been forgotten, Madam Speaker. Very interesting, Madam Speaker. In my preparation for this budget contribution, I took the opportunity to go through the budget statement of this government since 2016, Madam Speaker. And in every single budget statement, Madam Speaker, I don't have the time to read into it, but I have it here, Madam Speaker. In every single statement, Madam Speaker, this government has alluded, to having achieved both the global and regional 2030 targets for maternal, child health, and neonatal mortality. Madam Speaker, I am very happy for this. This means that the country is doing well. The country has built on the platform again that was left to them, Madam Speaker, by the People's Partnership government. And this is good. This is good for the country, Madam Speaker. But I only raise this in light of whether these gains have now been reversed in a serious way, Madam Speaker, and what has caused these gains to be reversed. I want to take the opportunity again, Madam Speaker. This issue of neonatal mortality and maternal mortality always becomes an issue in this Parliament, Madam Speaker. But let me set the record straight. Let's talk about neonatal mortality. And the rate is deaths per 1,000 live births, Madam Speaker. In 2000, we were in a bad place. It was 17.6. In 2022, it has come down to 9.7. I don't know what the figure is going to be in 2024, Madam Speaker. Obviously, those figures are going to be different. But, these things didn't come overnight, Madam Speaker. In 2010, when the partnership entered government, we met a rate of 14.2. In 2011, it was reduced to 13.8. In 2012, came down to 13.4. 2013, it was 12.9. 2014, 12.5. And 2015, when the partnership demitted office, under the member for Sipari, the rate was 12.2. So there has been a decrease. There's been a steady decrease in the neonatal mortality rates, Madam Speaker. Now, what about, the whole issue, the whole tragic issue is what has happened at the, at the NICU at the Port of Spain General Hospital. And I raise this, Madam Speaker, simply in light of, the PAHO report. And at first, when the report came out, there were many questions. The Minister of Health indicated that he had to make certain inquiries to PAHO, Madam Speaker. I want to advise the Minister of Health that the inquiries to be made, Madam Speaker, but it really should not be to PAHO. It should be to those who were charged with the responsibility for resourcing and managing the NICU unit at the Port of Spain General Hospital. And I trust, Madam Speaker, that as we speak 6 months later, and perhaps 3 months after the release of that report in June, that many of those recommendations, if not all, have been implemented, Madam Speaker, with the allocation to the health sector. And I see the Minister of Finance is hoping for the same, Madam Speaker. And I say this, in light, in the Minister's contribution, he said that he's taking personal responsibility for the children of this nation. But I also want to remind him, Madam Speaker, and I want to quote his words on the 26th of January, 2024, when he said, "Our greatest asset is our children." I quote, Madam Speaker, from the Hansard record. He said, "Under my 10 years Minister of Health, maternal mortality rates and infant mortality rates have dropped." And this was before the Directorate of Women's Health was appointed in 2017. "I took personal responsibility to save our women who were dying at the rate of 1 a month. I took personal responsibility to save our children in our hospitals, and because of my direct intervention," and so on and so on. So I invite the Minister to continue to take personal responsibility to make sure he fixes this matter, Madam Speaker, before he demits office, which should be not in the near distant future. Madam Speaker, I also want to raise one more question. I will move on from the issue of babies who have died to the issue of maternal mortality, Madam Speaker. And very disturbing information has come to my attention, Madam Speaker. And I really trust and hope that I am wrong about this. The death of a mother, pregnant mother, mother in childbirth, is a very stressful thing for the family, Madam Speaker, for both the loved ones and for the doctors who will provide care. And I want to empathize, if this is true, I want to empathize with the families, Madam Speaker. And I want to ask, whether it is true that over the course of this year, and again, I trust that the minister, will say that this is not true, that there have been the deaths of some 5 mothers in childbirth or related to childbirth at the Mount Hope Maternity Hospital, Madam Speaker. It is very shocking news. This apparently has occurred during the course of this year. And I want to ask, Madam Speaker, if this is true, whether any investigation has been done, Madam Speaker. And we spoke about the vertical services of the Ministry of Health, Madam Speaker. And one of those vertical services is a department called the Directorate of Women's Health. It was created by, through a report here. I don't want to waive this, I don't want to display this, Madam Speaker, but the national population now would be very familiar, with the report of the Maternity Services Review Committee, which was commissioned in pursuit of certain goals that the partnership government was fulfilling in terms of the MDG goals for maternal mortality and so on, which would have been, the target would have been 2015. And the Directorate of Women's Health would have been one of the recommendations, which the government took and ran with, and I mean, that's fine. But the question I ask is that, what is the extent of involvement of the Director of Women's Health in this issue, Madam Speaker? I raise this point simply because I want to say that in other countries, in the United Kingdom, for example, where I worked for several years, when you have a maternal death, it's a big thing. It's a big thing for the family and so on. But it's not a political issue, Madam Speaker. It is an issue, Madam Speaker, member for Port of Spain, North and West. It's an issue that, if it is handled properly, can create knowledge, information, and learning, Madam Speaker, for others in the profession. And the benefit of that, Madam Speaker, is that at the end of the day, the patients and mothers and so on have a better chance. Nobody is perfect, Madam Speaker. So the learning is shared, and one of the recommendations that was made, Madam Speaker, in this report, and which has not been implemented, is the issue of creating, a confidential inquiry. So it's not meant to point fingers, Madam Speaker. It's really meant to create a situation where you can have a national audit, which results in a national committee for confidential inquiries into maternal mortality. And I invite the Minister of Health, who has this report on his desk, and with the assistance of the Director of Women's Health, to look at forming this National Committee for Confidential Inquiry into Maternal Mortality, so that whatever happened in these deaths and whatever may happen in the future, that learning could be shared, Madam Speaker. And before I leave this issue, Madam Speaker, I want to give the basis for one of the policy points raised by the Honourable Member for Superior in the health sector, and that was the creation of a no-fault compensation scheme, Madam Speaker. In many circumstances, regardless of the best effort of healthcare workers and so on, patients will die, they will suffer injury, they will suffer less than optimal outcomes. And in that case, sometimes they have to go through the court system with the greatest respect to my colleagues here, Madam Speaker, and yourself. With the greatest respect, sometimes the outcome doesn't match, the compensation doesn't match, the injury, both mental and physical, that they would have suffered. And therefore, the issue of a no-fault compensation is well known in other countries, Madam Speaker. And the benefit of that, of course, is that it allows doctors to practice less defensive medicine, and it creates an overall benefit for the country, Madam Speaker. So I just want to throw that on the table, Madam Speaker. Madam Speaker, the issue of non-NCDs, non-communicable diseases, has been well ventilated by colleagues who spoke on the health sector. I will not repeat too much of what have been said, but there are a few issues that I wanted to raise, and of course, the Minister of Finance in his budget presentation did indicate that, there's a tremendous burden in terms of heart disease, diabetes, cancer, cerebrovascular disease. 70% of these deaths occurred before the age of 70. It's a very alarming statistic, Madam Speaker. And a PAHO WHO strategy report 2017 to 2021 stated that the economic burden from diabetes, hypertension, and cancer to Trinidad and Tobago is about $8.7 billion annually. So this is the economic burden, Madam Speaker. It's not the cost directly to the health sector. So it's a big burden in truth, indeed. It's approximately 5% of our GDP. So, Madam Speaker, there are two issues that when one speaks of the NCDs, and one is the prevention, and the other, of course, would be the treatment of the NCDs, Madam Speaker, because we have to fight, the fire while trying to prevent at the same time. And I just want to reflect on the WHO SDG target 3.4, which speaks to non-communicable diseases and mental health. And the target, of course, is to reduce by 1/3 premature mortality from NCDs through prevention and treatment and promote mental health and well-being. I want to take the opportunity today, Madam Speaker, to note that today is World Mental Health Day. And of course, I encourage all members on this side and the other side, to look at what we can do to strengthen and to take measures, Madam Speaker, to deal, to look at how we can improve our mental health. It's a big issue in Trinidad and Tobago, Madam Speaker. It's the elephant in the room. It's something that is underdiagnosed. We don't have the figures on the extent of mental disease within the population, Madam Speaker. And in the budget, it was noted, Madam Speaker, that Trinidad and Tobago, one of those documents that we have before us, that Trinidad and Tobago has the third highest prevalence rate of mental illness, schizophrenia, mood disorders, behavioral disorders, substance abuse, and suicide, Madam Speaker, being leading causes. And of course, teenage mental health should be made a top national priority, Madam Speaker. And Madam Speaker, I just want to leave that here by asking, what is the status of the mental health policy 2019 to 2029? We are now in 2024, Madam Speaker, and this policy is yet to be finalized, amongst several other policies that have been promised by this government. One of the interesting interventions I see being promoted, Madam Speaker, is the issue of a call center where those who have NCDs can call in now. Madam Speaker, I want to endorse the call center. I have a few questions, and I want to endorse the call center, Madam Speaker, but only to say regrettably that this suggestion from this side, Madam Speaker, it took 6 years to implement this suggestion, Madam Speaker. If you will permit me to read from the Hansard of 5th October 2018, it sounds like budget time. This would have been a budget contribution, And this is a member of Parliament myself making this suggestion, Madam Speaker. Again, one of the initiatives that I think could make a big impact would be to find a way for the state to get a scale-up blood pressure machine and a glucometer in every home. I know it sounds like a tremendous amount of expenditure. And now, with WhatsApp, you can have those numbers, talking about your BP numbers and your sugar numbers and so on. You can have those numbers sent into a central center, which is your call center here, Madam Speaker, where they can be manned by your doctors and nurses who can give advice and deal with the issues. So, Madam Speaker, this suggestion has been in the public domain for the last 6 years, and I congratulate the Honourable Member for St. Joseph for making that step. I think it would be beneficial in some way, Madam Speaker.
Honourable Member, you have 2 more minutes of ordinary time left. You have 10 additional minutes available to you to wind up. If you wish, okay, you may proceed.
Yeah. Make sure mental health.
So, Madam Speaker, I will move on, Madam Speaker. So, just before I leave NCD, Madam Speaker, I just want to put in a plug for those overworked doctors in the community clinics, in the primary care clinics, who these are overstaffed, especially when we have so many doctors looking for employment. So there are too few doctors to see the patients. The doctors have essentially become prescription writers, and because of that, patients sometimes don't get the ideal treatment in these clinics, and that adds to the burden of the diabetic and heart and kidney disease, Madam Speaker. Madam Speaker, I want to move on again. There's a lot said in the budget statement about eye disease, heart disease, and kidney disease. But I just want to endorse one of the policy points that was made by the leader of the opposition, the member for Siparia, in terms of creating and providing a stroke rehabilitation center, Madam Speaker. It is an important intervention. Hypertension is a big issue and it is sometimes, undiagnosed, Madam Speaker. And as a result, patients can suffer stroke and so on, Madam Speaker. And therefore, you need a dedicated center where these patients can undergo rehabilitation. The facilities available in the public sector at the moment are less than ideal, Madam Speaker. And I want to throw out another suggestion, Madam Speaker, to the Minister of Finance and the Minister of Health. In terms of the detection of hypertension, having a call center is fine, but that depends on people having their own machines and so on. Madam Speaker, there's a report which I came across in one of the documents here that was given to us, which speaks to 0.6% of the population, 10,000 people in 2021 were found to be multi-dimensionally poor, Madam Speaker. So that amounts to about 10,000 people. And my suggestion, Madam Speaker, is that even if these people want to call the call center, they will not have the blood pressure machine to check their numbers. And therefore, I want to suggest to this government, Madam Speaker, that identify these 10,000 impoverished citizens. You will know them because they already access services from the state. And, give them a blood pressure monitor, Madam Speaker, but tie it in to the fact that they will call in their numbers on a regular basis to this new call center we established. It will cost you about $5 million, Madam Speaker. But I give you the assurance, and I give the country the assurance that the country will save much more in the long term, Madam Speaker. Madam Speaker, as I move on quickly, I just want to make a plug again for the cardiac cath lab at the San Fernando Hospital. I don't hold my breath that this will be built during this financial year, Madam Speaker. This has been promised since 2016, and we want to give the population the assurance that it will be built under the next government, which will be a UNC government, Madam Speaker. Madam Speaker, what passes for treatment in the public health sector when a patient suffers from chest pain is nothing short of a travesty, Madam Speaker.
Definitely be
but, Madam Speaker, that is something that, I want to give the population the assurance. Madam Speaker, it will be remiss of me not to deal with the issue of COVID and try to put this once and for all, put it to rest once and for all, Madam Speaker. And let me make it very clear that under this government, Madam Speaker, over 4,500 citizens died, Madam Speaker. That's a fact, Madam Speaker. It's also a fact, Madam Speaker, that the Simongal report showed without a doubt that the Minister of Health and this government management of COVID was an utter disaster. Madam Speaker, Madam Speaker, they were completely unprepared for this epidemic. Madam Speaker, they failed to educate the population, and they created something called vaccine hesitancy, Madam Speaker. It's they keep talking about the vaccines and so on, but the lack of education, Madam Speaker, 6 months before the vaccines became available, there was in the public domain a report which the Minister of Health was privy to, and I myself was there at the meeting, which suggested that only 21% of people in this country would take the vaccines, Madam Speaker. So they were slow as well in terms of procuring the vaccines. And, Madam Speaker, they keep bashing the leader of the opposition, the member for Siparia, in terms of certain pronouncements and so on. But it is a fact, Madam Speaker, that some of the vaccines used in Trinidad and Tobago were associated with complications, Madam Speaker. All we are asking, Madam Speaker, what should have been done is for patients to make an informed decision in terms of being aware of what complications were available, Madam Speaker. So I leave that there, Madam Speaker. Madam Speaker, before I move on to my constituency for my remaining few minutes, Madam Speaker, I just want to touch on the issue of cybersecurity. The Minister of Health indicated that the electronic medical records are important. I think that's very important because one of the biggest constraints in the efficient running of healthcare services is the availability of medical records. Many times patients have their appointments postponed. After they wait 6 months, they go to the clinic and the doctor can't see them because their records cannot be found. I think the time has come for that to be a thing of the past, but also that we must take and put in place, I agree, that we must have proper cybersecurity legislation that is to accompany any attempt to implement electronic medical records and patient information sharing on online platforms. So that's the issue of cybersecurity. There's also the issue of bullying, which has come to the domain. I just raised that quickly, Madam Speaker, because on a daily basis now we're seeing the issues coming out in terms of school children. There's an issue in my own constituency, which I trust the Minister of Education is dealing with. There's pronouncements in the newspaper today. But I just want to make the point again that even though we have the issue of physical bullying, we also have the issue of cyberbullying, Madam Speaker, and this can be very troubling for children and even for adults, Madam Speaker. Madam Speaker, I am aware of this, Madam Speaker, because recently my wife and I were victims of this. I was shocked, Madam Speaker, that people can, bully you in this kind of way, and in terms of being able to hide behind a fake profile and so on. But I leave that there, Madam Speaker. My point, Madam Speaker, is not to, in any way suggesting that freedom of speech should be interfered with, but just to make sure that that the cybercrime unit has the appropriate teeth and so on to deal with these matters. Madam Speaker, I'll now move on to the constituency of Fyzabad. And
Great constituency.
the great constituency of Fyzabad, Madam Speaker, and and there are two issues. There are two issues. There are many issues in Fyzabad, Madam Speaker, but there are two I will raise, and those two issues, Madam Speaker, demonstrate how this government treats with some citizens in Trinidad and Tobago, Madam Speaker. And the first issue, Madam Speaker, is one that has already occurred despite several warnings to the relevant authorities. And today, the 10th of October, as I speak in this House, Madam Speaker, it is exactly 3 months. The 10th of July was when a bridge in St. John's Trace, Avocat, in my constituency, collapsed, Madam Speaker. The warning signs were there for all to see. The Honourable Minister for Works and Transport actually walked on that bridge himself a few years ago with me, Madam Speaker, and saw what's going to happen. We predicted this was going to happen, Madam Speaker, it's collapsed. But more than that, Madam Speaker, 3 months after, the residents, all 40 residents, are still using a boat, Madam Speaker, to cross. Some of them have had to abandon their residences, Madam Speaker. Yeah, they've had to rent places, Madam Speaker. They can't use their vehicles. Vehicles remain abandoned. And despite my best efforts to the ministers, responsible, Madam Speaker, my good friend from San Fernando West, Minister of Works and Transport as well, they have not seen it fit, Madam Speaker, to visit those residents. They're all tax-paying citizens of Trinidad and Tobago, Madam Speaker. I checked for myself. And the other thing I want to bring to the attention of the government, Madam Speaker, and to my friend from San Fernando West, is the issue of, on the Mosquito Creek, the cremation site, which houses hundreds of persons on a daily basis as they go to, pay the last rites to their loved ones, Madam Speaker. And this is the issue, Madam Speaker, of a gazebo which will very soon collapse into the shore of the Gulf of Paria, Madam Speaker. And I trust and hope that this site will not suffer the same fate as the bridge in St. John's Trace, Avocat, Madam Speaker. There are many, many other issues within the constituency of Fyzabad, which I will raise in different times and in different places, Madam Speaker. So, Madam Speaker, with those few words, I want to thank you for the opportunity to raise, and I hear my friend playing the blame game. I'll not be distracted, Madam Speaker. The politics of deflection is taking place here. Blame somebody else. So, Madam Speaker, with those few words, I want to thank you again for the opportunity to make this contribution. I thank you.